with the story of my biggest motivation. A couple, their name is Salek and Charmin. 5 years ago, Salek and Charmin came to us. Both of them are thalassemic. Charmin is thalassemia carrier and Salek is a thalassemia patient. So they had their first baby and they didn't go for any diagnosis. One of the rural doctors said that that baby is a thalassemia patient because their parents are thalassemic, and they started treatment for thalassemia immediately. The baby is 4 years old, but the baby is now sick, and day by day his situation is going to be is not going to be better. It's going to worsen. Well, they want to have another baby, but they found that they cannot have another baby because someone told that they are thalassemic, so whatever the baby is, boy or girl, that baby will be thalassemia patient. That couple was crying. They said, is it our fault that we are thalassemia patients? Because in society, in our village, most of the people are actually bullying us that it's like a crime that you are a thalassemia patient. So that's why you cannot have baby. And you are a thalassemia patient. And that's why your present baby is a thalassemia patient. We listened to their story. And then the first question that I asked them is, did your kid go through any diagnostic test? How did you become sure that your baby is a thalassemia patient? Well, doctor said, is that enough to make sure that he's a thalassemia patient? And how do you know that you cannot have a second baby? They said, just because people say. I said, no. There is a solution. From my previous study and background and research experience of 15 years in England, and then in Australia, and then in US, what we learned, what we experienced, and what we started to believe is your life can be better if you come to know about genome sequencing, if you come to know about gene sequencing. Sequencing is a wonderful technique which can find out the real reason of any disease. It's a wonderful technique to find out the real pathogen. So we took their blood, we took the blood of their baby as well. Then what we did, we sequenced some specific genes, some specific genetic variation that is responsible for thalassemia. And thalassemia is basically two types. One is like you can be a carrier, but you are not affected, and another one is you are a patient. What we found that their baby is not a thalassemia patient. His gene sequencing actually proved that he doesn't have that disease-causing genetic variant. So what was actually happening? For the past 4 years, that baby actually was going through mistreatment, wrong treatment. And now the gene sequencing technique proved that he is not a thalassemia patient. That gene sequencing technique, this technique proved that he can have a healthy life. He deserves a better life. And the next day we told them that you can have a baby. Who told you that if you are thalassemia, every single baby will be thalassemic? No. There is a law of genetics, and in that law of genetics, we always say you have 25 to 50% chance of having healthy baby. And then they were very confused. That lady got pregnant. In 6 months, they came to us. After 10 weeks of being pregnant, we took her amniotic fluid, and they were so scared. They said, we don't want to have another thalassemic baby, please. We just want to go for abortion. We don't want that baby. We don't want a baby carrying this disease, lifelong disease, for the whole entire journey of his life. We took their fluid, amniotic fluid, and we did sequencing, next generation sequencing, and we found that the new baby is not a thalassemic patient. And that's how And that time, the smile that we saw in their faces, that's $1 million smile. The smile that was in their expression, that cannot be, that cannot be bought. It's something special. That is what actually gene sequencing, genome sequencing, and this sort of molecular biotechnology can do. It can save life. It can improve life. It can find out the reasons of your disease. I myself call myself as a genome sequencing advocate, because what we have been doing is like sequencing from DNA. And one of my biggest motivation or sad story or inspiration is like seeing my father dying, suffering from unknown type of cancer, and he was suffering for 1 year. Not only my grandfather was suffering, my father's uncle, my grandfather, his whole family was suffering. They could not go to any festival. They were not able to enjoy their life. He was not able to eat anything, and everyone was saying there is no medicine. Everyone was saying we don't know how did this cancer happen. We don't know what's the actual genetic problem. From that moment of my childhood, I promised that I would study genetics. I would try to find out the reason of this sort of diseases. Why cancer happens? Why diabetes happens? Why Alzheimer's happens? Why Duchenne muscular dystrophy happens? And from that moment, we have been working in different aspects of genetics. So first question is, what is sequencing? If we come to the little bit of knowledge about genetics, we all have DNA in our cell, and that DNA has genes. Every single gene is responsible for a specific work. Gene actually secretes protein. So what we are actually doing, or what we are interested in every single DNA, all the genes together are called genome. So we are basically interested to know the sequences of gene. What sort of base pairs are there? What sort of nucleotides are there? Adenine, guanine, cytosine, or thymine? We have more than 10,000 genes in every single cell, and sometimes we are interested in whole genome, or all the genes together, or sometimes we are interested in just one single gene. Do you know, just one base pair or one nucleotide change or deletion of a gene can cause a big genetic disease. So sequencing is a technique where we can read all these sequences, and in sequencing, we use a specific machine called sequencer, and now there are lots of machines those are called actually next generation sequencing. So my research group, who we are actually detectives. You can call Sherlock Holmes. No, we are not Sherlock Holmes. You can ask, am I Feluda? No, we are not Feluda. You can ask, well, you're not like Indian CID hero, that big shot guy. No, but we all have a common thing. That is, we detect something. They detect the criminals, or they detect the reason of any occurrence, and we detect the reason of a disease. We detect the reason of a pandemic. We try to detect the reason of water being polluted. And for all this, we are using the technology, gene sequencing or genome sequencing. We have been doing, number one, we are very much interested on food, because there is a proverb that calls, you are what you eat. We believe everything, our health is actually dependent on our food. So we are very much interested on food safety. So what we have been doing is like trying to check, is there any pathogenic bacteria or virus or fungus in our popular foods using next generation sequencing. We are also trying to diagnose different diseases. We have found that in case of Chittagonian people, diabetes is a bit different. A lot of drugs that are working for other people or diabetes patients of other places of the country is not working in case of our patients. Why? It's because of their specific genetic changes. We found certain genetic changes are happening in Chattogram which is not found in other places of Bangladesh. So that means for that genetic change, you need a specific drug that will work against that specific genetic change. We are detective. We are trying to find out the reason of a pandemic. We work during pandemic and we will be working during pandemic. I will show you what we have been doing during pandemic, and also we are monitoring the environment, what's going on, what's happening in the environment. Using the next generation sequencing technology or using the gene sequencing technology, we are working. So in case of our main target, the patients, we are working for a better tomorrow. We are working for a healthier tomorrow. So we are using the sequencing. We are actually trying to find out the disease. We are trying to find out the disease earlier. I found one of my friend's father died just within 1 week of being diagnosed cancer. So what we want is like, if I can diagnose that patient in very early stage, then he has a better chance to fight. He has a better chance to take the medication. He has a better chance to dream to be recovered. And also genetic counseling. If both of you have genetic abnormalities, can you have a baby? What is your future? So we are using different sequencing technology, whole genome sequencing, whole exome sequencing, microbiome sequencing or microbiome profiling, and genotyping. So now let me tell you what we have been doing using all these sequencing platform or all these sequencing tools. We are a bit biased. What sort of biasness is it? We are working for Chattogram. Our main target, our first priority is to find out the health related problems of Chattogram. And then we are trying to compare them with the rest of the country. So for that, our first priority is health. We are working on health. So first fight, that was during COVID. During COVID, we had lots of questions. We have lots of dots which we could not connect. So first question, during 2020, everyone was saying that children cannot be affected and children cannot be COVID positive. But in 2021, a lot of doctors were coming and telling us that babies are actually COVID affected. They are COVID-19 patients. So what we did, we took the sample from the babies from Chattogram Mao Shishu Hospital. We did COVID-19 test. We found positive, and then we sequenced their genome, sequenced the genome of that virus, and then we found all those babies are affected by Delta variant. So what we proved for the first time in Bangladesh, we proved that babies are affected if they are actually affected by Delta variant of COVID-19. Before that, Beta variant was not the reason, was not affecting babies. And then we also, regularly we were monitoring different variants. So we have a special technology called phylogenetic tree construction. We constructed phylogenetic tree and we could trace the source from where that virus is coming. Which country's virus has the similar sequence of that virus, that variant. Then what happened? We were able to convince the airport authority to stop immigrants from those countries. After detecting Omicron and after finding out the source of Omicron, we were able to convince the airport authority to have special precaution for those special countries. So, first success was in 2 medical colleges and hospitals. they started having special ward for COVID affected babies after our research article came to, one was in Lancet and another one is Willy. So we said, yes, that's our success. Our research is now being implemented. Now the hospitals are actually listening to us. And then what happened? They had a separate ward for the COVID affected patients and another ward for the non-COVID babies. And another success was like we found some specific genetic changes in Bangladesh because of our environment and our other changes. And we found for the first time that one out of 4 COVID patient is actually a diabetes patient. So diabetes patients are actually under danger. So a lot of diabetes hospitals and a lot of endocrinology department of medical colleges opened new ward, new section for the diabetes patients who are being affected by COVID. They need special care. They need special treatment. So that's something we were really happy to see being implemented. Now, dengue. Every year, dengue happens. Our question is, every year it comes and goes, but still there is no precaution. Nobody cares about dengue. In 2023, there was the highest number of deaths in Bangladesh. And we found highest number of people were actually getting admitted to the hospitals. So our question was, what's the reason of dengue being so much pathogenic and so much lethal? So we started doing serotyping, which is like using the sequencing technique. We were trying to check which specific type of dengue is circulating in Chattogram, den 1, den 2, den 3, den 4, and also is there any specific genetic variation in these dengue virus of Chattogram for what most of the people are going to hospital or a lot of people are being dead? What's the reason? Then our research article came. We had 4 research projects, and as a result of those research projects, first thing that we identified is like we identified the hot spots of Chittagong. We found that Chowk Bazar, Kotwali, Bakulia and Bayazid, these sort of areas are the hot spots. And in the rural areas, Hattazari, Potia and Konnufuli were the hot spots of dengue. So government didn't listen to us in 2023, in 2024, but end of 2024, government started listening to us. Now the civil surgeon office, in the right side of the news, you can see civil surgeon office is now working on those hotspots. So our research actually helped the policymakers to trace out the dengue hotspots, to work on specific areas where dengue is happening. And more interestingly, we were actually curious to know from where these viruses are coming. We found that we have a very deadly virus in Bangladesh, which is called cosmopolitan variant. So our question is, how did this cosmopolitan variant come to Bangladesh? Because this cosmopolitan variant is very dangerous, lethal, pathogenic, and it's serious. So we found when we sequenced them and we compared with other sequences of other countries from the database, we found that they came from India and Myanmar. So our request to the government is, during dengue season, you must screen people who come from Myanmar or India for dengue, like COVID, because they are carrying some of them are carrying dangerous variants for the country. So this is how we are actually trying to trace the pathogenic virus. Now, as we said, if you want a better health, you should have good food, better food. So we were curious to know that how much safe our food is. We have a sequencing machine. We got that sequencing machine from Fine Diagnostics Switzerland back in 2021 from a grant. And from then we have been doing continuously sequencing of different samples of Chattogram cell. So we were interested to know, one of the most popular food of Chattogram is yogurt. How much safe is yogurt? And our yogurt, do they have the ability to compete with the global standard brands? So what we found that some of our most popular buffalo yogurt is full of fungus and pathogenic bacteria. A lot of people even don't know the reason of their pancreatic cancer or respiratory tract problem is actually having buffalo yogurt regularly. So we need to take precaution regarding this and we try to find out the reason of these fungus or pathogenic bacteria. We found that those dairy producers, they don't boil milk before producing yogurt, buffalo yogurt. Whereas in case of cow yogurt, they boil it. And the good news is, in case of other yogurt, we found the top 5 Bangladeshi brands are safe. They don't have pathogenic bacteria. So that means our Bangladeshi cow yogurt is actually world class. We can export them and that is safe. So we are ready to give them a certificate that we used a technology called next generation sequencing. Using that technology, we can sequence all the bacteria, virus and fungus present in a food or any sample. We call it microbiome profiling, like all 1000 bacteria, virus can be sequenced in just one single go. And we found that our yogurt is safe except the buffalo yogurt. So that we published that in a Nature Portfolio Journal scientific reports. So next we were interested to know about Hilsha, which we call Elish. Why our Elish is having an amazing taste? Why the smell is so nice? And our question is our Elish authentic? Does it have anything special which we can prove scientifically? And we found that our Hilsha has got some exceptional bacteria which are good for health, which is nutritious, who can produce good proteins, and that proves that our Hilsha is unique. We can export it in anywhere in the world, and it's really precious. So this is a scientific evidence that our Hilsha does not contain pathogenic bacteria. We believe that we have the best Hilsha in the world that scientifically we can prove. One day, like in 2020, end of 2021, we had a businessman from Cox's Bazar. He came to my lab, our department, Mr. Abdul Barek. He said, in Bangla, he said, "Amake bachan, amar to 40 koti takar loss hoye gelo. Save me. I'm having like 4 billion Bangladeshi taka loss costing 4 billion Bangladeshi taka." We said, "Why?" He said, "All my shrimp, I have a hatchery, I do shrimp business, all my shrimp are dead. Something happened, some sort of virus or something came there, and when it infects one shrimp, the whole aquaculture pond, the whole hatchery gets affected. And every year the Bangladeshi aquaculture, Bangladeshi shrimp farmers are having a loss of more than 600 crore taka because of this virus." The problem was, we didn't know what type of virus it is. And the second problem is, we didn't know how to stop this virus. So, when I went to George Washington University, US, I got trained, I did my postdoc there, and then after coming back to Bangladesh, I took the challenge. I said, I will start genome sequencing of white spot virus. We did genome sequencing of white spot virus. We were successful. You can see it has been published in American Society of Microbiology. And now, what we can do? We can dream for a vaccine. Before designing a vaccine, you need a genome sequence. Without a genome sequence, you cannot have a vaccine. So now we have the genome sequence. We know what type of virus is actually circulating in Bangladesh. The genome sequence of Netherlands or America or US or England will not work for us. We have to have our own samples genome sequencing. Now we do have that. And Daily Star calls it game changer because this genome sequencing will change the game. Prothom Alo says that it will definitely it will definitely prevent the financial loss of our sector. This is how sequencing, next generation sequencing, gene sequencing or genome sequencing can actually fight against bacteria or pathogens. Now the question is our target publishing papers or just doing research? No. I believe that my main responsibility is creating future researchers, building future scientists. So what we have been doing? We have a special project, building the scientists of tomorrow. In our lab, every week we call 7 students from different universities or colleges or even schools. We call them, we train them, we show them how to extract DNA, we show them how to do PCR, we show them how to do genome sequencing or gene sequencing, we show them how to do bioinformatic analysis, and we actually create dreams among them that one day they will be biotechnologists, they will be genetic engineers, and they will fight against diseases. So far, in the last 2 years, 150 students got trained for free in our laboratory, and we believe that this laboratory, it's not just my laboratory, it's a Bangladeshi laboratory. This laboratory is for everyone of Bangladesh. So students from 27 different universities got trained, and also we go to school. You can see Sahajpat Fulki. We went there. We went to Aboriginal schools and different other schools to train people, and we arranged first diabetes summit for the youngsters of Chittagong. These are the people who are working with me. My laboratory is Disease Biology and Molecular Epidemiology Research Group. That's my research group. And the name of my laboratory is ENRICH, Next Generation Sequencing Research and Innovation Lab Chittagong. And most interesting thing is, at present, 70% of my lab members are female lab members. I'm so proud of them. Despite of being being girl, they are actually crossing barriers, lots of obstacles. And because of them, we can publish in Nature, Lancet, in top 5% journals of the world. So what's our dream? Our first dream is just to give people a chance to save their life. I don't want anyone to die within 1 week of being diagnosed like a cancer patient or being a diabetes patient. We want to develop a diagnostic tool by using which you can know you have a chance of diabetes or cancer or neurological disease in your early childhood, in your early ages. You have a genetic variation, you do a PCR, and then you come to know you have a chance, then you modify your lifestyle. You restrict your lifestyle. You might be able to avoid the disease, or you might be able to avoid the severity of the disease. So we have been sequencing the candidate genes of different diseases. We are now preparing a panel of genes who are actually responsible for different disease and the genetic variations unique in Chattogram. So that after 5 years, the doctors will not just straight away prescribe a drug. They will ask you, okay, go do a PCR or do a sequencing check if you have any of these 5 mutations. Then the patient will come back, the doctor will see his genetic makeup, and the doctor will say, oh, you have TCF7L2 mutation. That means you cannot have insulin. You have to have metformin. That's our dream. Drug for individual person, not a general drug for everyone. Developing a diagnostic tool which will help you to know the disease earlier, and also building genome sequencing facility all over the Bangladesh. So for that, we need financial support from the government. We need government policies where drug for individual person, not a general drug for everyone. Developing a diagnostic tool which will help you to know the disease earlier, and also building genome sequencing facility all over the Bangladesh. So for that, we need financial support from the government. We need government policies where the healthcare sector will not only be dependent on doctors. Healthcare sector needs microbiologists, biochemists, biotechnologists, genetic engineers, computer engineers, programmers, statistician, public health worker, health economist. A lot of people are stakeholders of health. We have to be included in the policy. Otherwise, there will never be facilities for diagnostics. Every year, we send more than 500 crore, the samples costing more than 500 crore to Indian or other countries' diagnostic labs. But we say, we can do it. We have the capacity, we have the skill, and we have the machines. So why not investing in Bangladesh? Why not investing in Chattogram? Why should we send our samples to India or other countries? We want to do it, and we can do it. And we want to develop a lot of local entrepreneurs who will invest in this sort of sequencing and molecular diagnostic techniques, and we want to develop kit from our country. And finally, I'd like to say, we are working for a better tomorrow. We are working for a healthier tomorrow. We dream a world, we dream a Bangladesh, we dream Chittagong, where no one will die being undiagnosed, where no one will be diagnosed when it is too late. We want you to be diagnosed before it is too late. Thank you, everyone.